Hello everybody, thank you for joining us again for Thursday Thoughts. Since it is still the month of October, we're doing all breast related topics for this month. Today I'm going to be going over implants. We're going to specifically breast implants and talking about the different types and possibly even getting into how we choose size and other things like that. But it's a pretty big topic, so we'll get started with one of the first differentiating factors between implants when we're choosing an implant or what we're recommending to patients. First is the question of saline versus silicone. So what does that mean? A saline implant is one that comes as an empty shell, something like this, that we actually have to fill up. This is actually a temporary sizer that we can use during procedures before choosing a permanent implant, but it has this little hose attached to it. You can fill it up with saline, salt water. And that means you can adjust the size a little bit, even though it has a set size that it's supposed to be filled to. Versus a silicone implant, it's filled with a highly cohesive silicone gel. But keep in mind, both the saline and the silicone implant, what's actually touching your body is still a silicone shell. So when I have patients that come to me and say, "Doc, well, I only want a saline implant because I'm afraid of the silicone," still what's really touching your body is a silicone shell with both of those implants. What the difference is how we detect a rupture with these different implants. If you have a saline implant that's filled with salt water, if you have a rupture, you're going to get a flat tire. Your breast is going to deflate, and you're going to know within a few days if you actually had a rupture because you're going to notice this difference in the size of your breast. Whereas a silicone implant, even if you get a small rupture or tear, that silicone kind of stays in place. This isn't like first generation silicone implants where it was this very gooey gel. This is what we call the gummy bears. If I was to cut this implant in half and squeeze it, it actually stays formed because it's a cohesive gel. And so we can't always identify a rupture just on physical exam. So that's why they recommend for silicone implants that after we place the implants, 5 years after placement, you should get either an MRI or an ultrasound to assess to see if there's any evidence of rupture. And then every 2 to 3 years after that. Again, with the saline implant, you're going to know if you have a rupture because you're going to have a deflation. Now we're going to get into the texture or what the material is on the outside of the implant. And this has come under scrutiny recently because of something called breast implant associated ALCL or anaplastic large cell lymphoma. This is a newer, very rare diagnosis, but it was associated with implants that had textured outer shells. Textured meaning it had almost a sandpaper type feeling to it, and this allowed us to do certain things like use shaped implants or those teardrop implants that we used to hear about a few years ago. Most surgeons in the United States have completely stopped using textured implants, even though they are still available on the market, because of that of getting anaplastic large cell lymphoma associated with it. So I only use, and everybody here at Pure only uses smooth implants, meaning the texture is very smooth, and this has virtually not been described at all with the breast implant associated ALCL. So that's why we choose those implants. With that being said, we can only use round implants because these round implants, if they rotate or turn once they're placed, it's not going to make a funny shape. Those shaped implants with the textured sandpaper feel to them, they could put a teardrop shaped implant in, and that texturing actually kept it from rotating. So that's when they were able to do those shaped implants. But with how implants are designed now, our latest generation of implants, they have this highly cohesive gel. They don't ripple nearly as much as they used to. They're really a quality implant, and with our different techniques for placing implants, we really don't need those shaped implants to get a great natural looking result with breast augmentation. So by and large, I use silicone implants. I think they feel more natural, they look more natural, they have less rippling, and frankly, I think they're probably going to last longer than saline implants. So most of my patients, I guide them to silicone implants. If anyone has an extreme aversion to silicone implants, we do offer saline, but most of my patients get silicone implants. That's the big topic about different types of implants, and I think we'll get into another week getting into how we choose the size of implant for individual patients. With that being said, any questions regarding this topic?
Yes, we have a few questions here. The first, is it true that you should replace your implants every 10 years?
This is a question we get often because manufacturers kind of guarantee implants for about 10 years. But if you're not having a problem with your implants, and we need to verify that with the imaging studies we talked about earlier, either an MRI or an ultrasound for a silicone implant. If you're not having an issue, you're not having a capsular contracture, no, we do not need to arbitrarily replace implants every 10 years. We wait till there's an issue with it.
Do you do fat transfer to the breast? I'd rather that than use an implant.
Yes, I will do fat transfer to the breast for the right patient, and you have to have the right expectations. Fat transfer to the breast is a little different than different parts of our body. We use it a lot in reconstruction. We use it a little less in cosmetic breast surgery, but we're starting to use it more. One of the issues with breast fat grafting to the breast is that the take of fat is less than other parts of the body. So we only expect about 50% of what we transfer to stay long term. And so you have to be cognizant of that and understand you may need a second or a third round of fat grafting to really get the result you want. Sometimes it's also an adjunct to doing an implant. If you have one little area that has a defect that we need to plump up or fix a contour irregularity, it's a great thing for that. That being said, fat grafting to the breast, we need to keep in mind that it has the potential to make breast cancer screening a little bit more difficult. Sometimes we get fat necrosis and that may show up as a suspicion lesion. And people may need to get additional biopsies in their life with fat grafting to the breast, even though most radiologists say they can really clearly see if it's fat necrosis or something related to fat grafting rather than a cancer. It is something I like to discuss with patients.
What brand of silicone breast implants do you use?
We use all Allergan products here at Pure Plastic Surgery, and I really think they're the leader in the industry when it comes to breast implants, and they have a good warranty and great company to work with, and they make a very quality product.
Where do you place the breast implants, above or below the muscle?
So I always recommend below the muscle. I really never do above the muscle unless you already had implants in that pocket. We're just exchanging them. Sometimes it's not worth making a new pocket for them. But I go under the muscle or under the fascia. Those are the two things that we can do. But we do that for two reasons: to decrease the risk of infection and decrease the risk of capsular contracture, or that abnormal scar tissue that can form around a breast implant.
Okay. Please please explain the use of scissor during augmentation procedure.
Okay, so some patients, if they have asymmetries before surgery, we may use scissors, this is actually a saline scissor that I just temporarily fill up with air to kind of adjust to make our final choice for implants that we're going to be placing, to kind of fine tune the sizes that we'll be choosing for the different size breast.
Will the implant lift the breast?
The implant can very modestly lift the breast by filling up the skin envelope, but it's not a substitution for a lift if you really need a lift. Certain patients are borderline, and we can have a discussion about that in your consultation, but it does modestly lift the breast by filling up the skin envelope.
Do you still accept photos for first appointment?
Yeah, it's a great way to get the process started, send photos, but we always have an in-person consultation at some point throughout the process once you book surgery with us.
Yes. What are the risks of a breast augmentation procedure?
So we'll always go through this with your consultation, but quickly there's just general risk of surgery, incisions, anesthesia that are true for any surgery. So quickly going over for breast implants, the main ones that we talk about are the risk of infection. If that were ever to happen, we need to remove that implant, let the infection clear before we replace it. This is very uncommon for cosmetic augmentation, primary augmentation. The other thing is a capsular contracture, which is that abnormal formation of scar tissue around the implant. And if that were to happen, we may need to do additional surgery or put you on medication for a period of time to help improve that. Those are the main things associated with breast implant. All right, everybody, thank you so much. Have a great day, and I look forward to seeing you next week.